Based on new projections, prevalence and costs will increase dramatically in the next 2 decades, creating a cardiovascular crisis of alarming proportion that we are ill-prepared to address as a nation. By 2030, it is projected that 2 out of 5 Americans, or 116 million people, or 40% of the population, will have some form of cardiovascular disease. And direct medical expenses are expected to triple to a total of $818 billion, and indirect costs will increase to $276 billion. So total direct and indirect expenses due to cardiovascular disease in this country are expected to exceed $1 trillion by the year 2030, nearly equal to today's federal budget deficit. Unhealthy behaviors are on the rise, as are unhealthy environments, and an onslaught of risk factors affecting Americans of all ages. In fact, we're seeing a frightening increase in obesity and diabetes in our population, starting with our youth all the way up to our seniors. These factors show no signs of abating and, in fact, could accelerate. Recent studies show that today's overweight adolescents will bump up future adult obesity rates by 5 to 15% by 2035. That alone would lead to 100,000 additional causes of cardiovascular disease, along with an increase in associated costs of $254 billion. We project a 200% increase in the cost of both coronary heart disease and heart failure, and a 238% increase in stroke. If there's a silver lining in these figures, it's that they're projections, and actions we take today can change this outcome for tomorrow. Unlike some diseases, we know how to prevent or delay many forms of cardiovascular disease. That's why prevention is the cornerstone of the American Heart Association's new decade-long initiative to improve the cardiovascular health of all Americans by 20% by the year 2020, while reducing deaths from cardiovascular disease and stroke by 20% during the same time period. Better prevention also means increasing our access to health care for everybody in this country. This will allow more people to receive timely guidance to take control of their own health and timely clinical intervention if risk factors emerge. Increased access is important because prevention is underutilized in disadvantaged individuals and communities. Today's report cites disparities in cardiovascular disease incidence and outcome across socioeconomic levels, as well as geographic regions. Among racial groups, African Americans bear a disproportionate burden of cardiovascular disease compared to Caucasian or Hispanics. As we work to improve the quality of care, we also need to address a looming shortage of healthcare professionals in the fields of medicine, nursing, and pharmacy. As stated in today's report, primary care physicians are already in short supply, and that shortfall is even greater for cardiac specialists. We already have a shortage of 1,600 general cardiologists and 22,000 interventional cardiologists. The number of cardiologists would have to double by 2050 to erase the expected shortage of 16,000. To conclude, let me state that our projections are based on a scenario in which no changes are made in our current healthcare policy and no further action is taken to reduce the disease and economic burden of cardiovascular disease. The American Heart Association and our partner organizations plan to continue taking action. Therefore, we see many great opportunities to improve cardiovascular disease health while controlling costs. In short, health promotion, early intervention, affordable access to care, evidence-based guidelines, and other public policies are absolute musts to stave off these projections and move the health of our nation in a more positive direction.